Rat Lungworm Disease, RLWD, is a serious parasitic infection that poses significant health risks. Neuroangiostrongalysis is the medical name. It primarily affects the brain and spinal cord, leading to severe neurological symptoms. This disease is caused by a parasitic worm called Angiostrongalus cantonensis. It was discovered in Canton, China in 1913. This parasite is microscopic in size and deadly. It is not your typical parasite. This worm lives in rats, which act as the primary hosts for the parasite. There are many hosts that can carry this disease and spread it. It spreads to humans accidentally through the consumption of contaminated food and water, often through raw or undercooked snails, slugs, and other carriers. You can also get it from working in your garden. RLWD is a growing concern worldwide, with increasing cases reported each year. It is predominantly found in tropical and subtropical regions where the climate is favorable for the parasite. However, cases are also increasing in new areas, extending beyond traditional regions. This spread is due to factors like climate change, which alters habitats, and globalization, which increases human movement. The early symptoms of RLWD are often mild and non-specific, making it hard to diagnose initially. These symptoms can easily be mistaken for other common illnesses like the flu or a mild viral infection. Common symptoms include headache, fever, stiff neck, headache, nausea, light sensitivity, skin crawling, nerve pain, and bladder issues, which can escalate rapidly if not treated promptly. Early diagnosis and treatment are crucial to prevent severe complications and eliminating long-term neurological symptoms that have no cure.
Once inside a human host, the parasitic larvae migrate to the brain, the eyes, the spinal cord, and major organs. They travel through the bloodstream and the lymphatic system. In the brain, they cause inflammation and damage, resulting in swelling and headaches. This leads to a condition called eosinophilic meningitis, or neuroangiostrongliasis.
The impact on the central nervous system can be severe and cause temporary and lifelong damage. Those infected during the acute phase may have an onset of severe neurological problems that seem to come out of nowhere. If left untreated, they can lead to paralysis, seizures, and a coma. In some cases, RLWD can be fatal. Early diagnosis is vital and should be encouraged. This can help prevent long-term complications.
Diagnosing RLWD can be challenging. The symptoms are often subtle and can easily be mistaken for other more common conditions. Early treatment significantly reduces the risk of long-term neurological damage, which can be debilitating if left untreated to resolve on its own. Pinworm medication is available over the counter and should be taken immediately after consumption or exposure to a vector like a slug or snail. Symptoms often mimic other conditions, making it difficult for doctors to pinpoint the exact cause without extensive testing. Doctors rely on a combination of tests, including blood work, a lumbar puncture, imaging studies, and sometimes even genetic testing to confirm the diagnosis. These include a detailed medical history, physical examination, and analysis of cerebrospinal fluid. Each step is crucial in ruling out other potential causes.
The latest research shows that the anti-parasitic medication albendazole and a corticosteroid called prednisone are the primary line of defense. These drugs are specifically designed to target and eliminate the parasitic worms. The sooner they are taken, the faster the body can eliminate the parasites. They target and kill the parasitic worms in the body, effectively reducing the parasite load and alleviating symptoms. Public awareness about RLWD is crucial. Educating communities can lead to earlier diagnosis and treatment. People need to be informed about the risks, symptoms, and the importance of seeking medical help promptly. They also need to know how to prevent infection. Simple measures can make a big difference. This includes thoroughly washing fruits and vegetables to remove any potential contaminants. keeping host populations down around your home and garden, and use caution when handling potential hosts' animals. It also involves ensuring proper food handling and storage to prevent the spread of parasites. When in doubt, throw it out.
Globalization and climate change contribute significantly to the spread of RLWD, a disease that knows no borders. Increased travel and trade can introduce the parasite to new areas, making it a global concern. Warmer temperatures can also expand the range of its host snails, allowing the disease to thrive in previously unaffected regions.
Preventing RLWD requires a multi-pronged approach involving various sectors and strategies. Public health campaigns are essential in spreading awareness and educating the public, educating communities about the risks and preventive measures, empowering them to take action. This includes controlling rat populations, which are primary carriers of the parasite. It also involves promoting safe food handling practices to prevent contamination. RLWD is a serious public health threat that requires our immediate attention. However, by understanding the disease, its transmission and prevention methods, we can protect ourselves and our communities effectively. Stay informed, take necessary precautions, and spread awareness to combat this silent invader. Together we can make a difference and stop rat lungworm disease.